Hello, I'm here to do the newborn assessment video. We're going to pretend that we're teaching a new nurse on our unit what it's like to work there in the labor and delivery unit. We're going to do a head-to-toe assessment. We're going to use my doll. His name is Timmy. Timmy the T-Rex. He's going to be my patient today. And then we're going to get all that set up. So, as a new nurse on our unit, we're going to be making sure that we use this form with all of our patients because documenting everything is key. So you have your assessment date, your vaginal or C-section, parent age, your feeding method, if they're breastfeeding, the parent's health beliefs and practices for care of the infant. So do they have any cultural stuff you gotta know about? Are they doing any C-sections? Anything like that. And right here we have our normal vital signs. So you're gonna have an axillary temp of the patient. So I'm gonna show you a quick example of me taking the axillary temp, the pulse, the respirations, and the CCHD. What the CCHD is, if you don't know, we have actually added a nice little hyperlink in here. So if you click on our link through our facility, it takes you up to a link and it's congenital heart disease. Okay. So with that, we're going to look for an axillary temperature between 97.7 and 99.5, a pulse of 120 to 160, and about in the fifth intercostal, and respiration between 30 and 60 per minute. Any abnormalities would be a lower high temp, a lower high heart rate, so either below 100 or above 160, and respirations below 30 are an issue, or increased respirations are an issue. So, the axillary temp here of Timmy. Here's his armpit. We're going to stick the thermometer right here. He's in this warming area right now, so he's nice and warm. He's in normal temperature. And we got a temperature of about 98 degrees. He's looking good. We counted his respirations for a minute. We've seen his chest moving in and out, making sure we're doing clear sounds. And we got about 50 right there, so he's breathing normal. And his apical pulse is in his fifth intercostal right here. And everything checks out to be really, really good. We just did a weight on Timmy. A normal baby's between 5 pounds, 8 ounces, and 8 pounds, 13 ounces. Timmy here on the scale. Let's weigh him up here. Come here, Timmy. Timmy weighs 7 pounds. He's a healthy baby. All right, let's do his length and his chest diameter, because his length should be between 19 and 21 inches. Timmy is a little bit bigger than 21 inches. He would be called what's an LGA baby. He's large for his gestational age, but Timmy's healthy. He's okay. He fits normal parameters for what we're doing here. Okay. Next on our sheet, we have posture. In here, we have a link that will take you to all of the postures, how the arm is supposed to work, how the wrist is supposed to go. You have to test the baby's wrist, put it at a 90-degree angle to make sure he's flexed. His arms reflex back. He's not pale or white or blue. He's supposed to be green since he's a dinosaur. So Timmy can keep being green. His foot, his plantar flexation. How does his plantar flex work? Is he working okay on his feet? Everything seems to be going good here. You can't hear Timmy crying because he's been out of birth for a little bit, but he has a large, lusty cry, and his genital area is free of lesions. He's clean here. We just got done getting Timmy changed, so he's doing really, really good over here. Everything looks healthy on him. All right. He has a loud cry. His skin's good. Some things you might note that could be wrong is the cry could be weak and quiet. The skin could either be blue or cyanosis or yellowing due to jaundice. If he has jaundice, you're gonna want to get with the PCP and get some bilirubin tests going, see what that's going like, check the liver function, get him under some lights to make sure we can get all that going. You're gonna have some normal vernix on him. His is yellowing because it's getting off. We got washes off of him, but it should be white. Any discolored, this isn't really enough for us to be concerned. If it was more green like this, we'd have an issue. His head, his sutures are well approximated, so he doesn't have any lesions or gaps. So he's doing really good there. He doesn't have any excessive hair growth, and he's doing really good on his head. Let's check out his ears. His ears should line up with the calcus. They should be completely formed, and he should be startled by loud noises. So if I yell, Timmy might cry. But we don't want Timmy to cry right now. But I might give him a little shouting match. So his ears are a little up here. They're just above his eyes. For this species, it's a lot better. But it's not the complete human normal. For this instance, it is even with his calcus right above his eye where it should be. Alright, his nose should be up here flat and normal. So this is not bad. It's a good flat nose. Normal, he can breathe well, he has a patent airway. You don't hear any auscultations in his lungs. We'll do another quick little auscultation check with my stethoscope. My hand being the stethoscope. He's clear on the left side. And he's clear bilaterally on the right side. Good job, Timmy. Some abnormalities could be a deformed airway. You could have obstruction. You could have a lot of mucus in there, so he can't breathe. And the baby should be rooting and swallowing, so that way that's like a natural thing that comes with them. We know how to eat food and suck on bottles to get our food. So, let's see what else we have in here. His neck, we'll check out his neck. It should be intact with no lesions. His neckline here, he's intact, no lesions. One good firm coat over here. The nipples are present. There's his nipple, symmetrical bilaterally. Meconium. So Timmy is 36 hours and it smells like he just actually had his first stool. I think it's dirty. Whew. It's a little dark, which is actually normal. It should be black and gradually decrease to like a green and then a brown. So this is healthy actually that he had it within 36 hours. It's pretty good. Let's add, make sure he has any bowel sounds. Let's see. Let's take our little stethoscope, hand stethoscope again, and we'll listen to his bowel sounds. Present in the upper left quadrant, present in the upper right quadrant, and present in the lower quadrants. Hyperactive. He sounds like he has a lot of bowel sounds in there. He's getting ready to keep going because he's been getting fed. Alright, if Timmy were a female patient, we would do an inspection on the genitalia. We'd make sure that the female patient had no discharge. It could have it should have a little bit of white, a little bit of bloody, but nothing excessive. A little bit is normal. And so since he's male, we're going to be sitting here, we're going to inspect him again, make sure everything else is normal. Again, there was no lesions, but let's see. Doesn't have any redness, bleeding, or edema around his circumcision site, so he's doing really good. And then there is no hypospadia, which is an opening of the urethral at the bottom. We actually, again, have a nice little hyperlink in here for our facility for multiple words. So hypospadia is a birth defect in which the opening of the urethra is on the underside of the penis instead of at the tip. So that'd be a major birth defect that we're looking for, is assessing the full genitalia. And then we have the extremities of the baby. This is one of the quickest things that we do here, but let's see what we have. So we have the movement. When I see Timmy can wiggle his arms really good. He has full range of motion in there, no discoloration. He has strong muscle tone. He has no swelling or any lesions in here. He's fully intact. Alright, this is gluteal thigh creases. There's a gluteal thigh here. Let's see. Let's check out the creases on this. That's some very good healthy creases on both legs bilaterally. Okay. And then he has some good knee clicks. We heard those in there. Last thing we're going to go through is checking the baby's reflexes. We have a ton of reflexes we like to go through, and we got to make sure that they're there. So one of the first ones is the Moro reflex. Is when the newborn flex should be seen when the baby's startled and extend the arms and throw his head back. So what I'm going to do here is I'm going to scream in Timmy's ear, and he's going to throw his arms up. So when I go, ah, Timmy throws his arms up. He's the plantar grasp, which he'll grasp the thumb with their toes when the thumb is placed on the sole of their feet. So, Timmy here, I place my thumb here, and he grabs the best he can with his dinosaur feet. You have the Babinski reflex is when you stroke the newborn at the bottom of the foot, the toes will flare out. So when I go like this, his toes flare out, which means we have a positive Babinski. There's also the rooting. What we have in the rooting is when you stroke or put an object at their mouth, they'll start making a sucking motion. So we'll feed Timmy, and he starts eating. Sucking reflex, they develop this very young. They suck on their thumb in the womb. Swallowing's present. While he's eating, I can hear him making valiant efforts. Goom, 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 goom. While he is eating. We have the tonic neck, where the newborn makes a classic fencer position. One arm outstretched and the other one bent. So you can see here, he's sticking out in a fence, and he's all ready. And the last thing, we have two more here. We have the gallant, which is an incurvature of the simulated spine, which if you just lightly go down the side of their spine, they kind of flare out a little bit. Timmy, and flip him over on his back. And he flares out while doing that. Alright, and then we have the stepping reflex. This one is when the baby's held upright. They extend their legs. It's after birth, and it disappears about 2 to 3 months, but they kind of naturally know how to walk and use their legs. So when you're holding the baby by the arms near the ground, it will start to kind of form some steps together. You know, that's not the full-fledged human step, but it's definitely a natural reflex that these kids have in them. Another assessment we have to do is on the palms. There should be a 3-crease palm, but some abnormalities could be absent or 1 crease. And that is my assessment of Timmy.